So many of your personal training clients complain about shoulder pain. If so, then you're going to want to listen to this. I'm Jason, exercise therapist at goXpro, and today we're going to take a look at one form of shoulder pain that as a personal trainer or regular gym goer, you will definitely come across. It's known as weightlifter shoulder or AC joint pain. Clients with weightlifter shoulder will complain about AC joint pain and tenderness. You'll often see them holding their shoulder and rolling it forward as they come off a heavy set of bench press, for example, or rubbing the AC joint to try and alleviate the discomfort. So what is weightlifter shoulder? What happens to the muscles around the joint? What causes it? And what can we do as personal trainers to help prevent it? Weightlifter shoulder is acromioclavicular or AC joint degeneration and osteoarthritis. Recovery time from this type of injury is normally 3 to 9 months if treated properly. Weightlifter shoulder starts off with pain and inflammation, then the scapular muscles start to switch off and the whole joint becomes unstable. Poor form sets in, especially during any forward or overhead pushing exercises. As the muscles that externally rotate the shoulder shut down, we start to see a superior and anterior migration or an up and forward movement of the humeral head. This can lead to other shoulder problems such as shoulder impingement. It takes a lot of chronic wear and stress on the AC joint to get to the stage that the client really feels discomfort, but this is when the arthritis sets in, especially if they continue to load the joint. So what causes weightlifter shoulder in the first place? Well, the two most common causes are heavy bench press and repeated overhead movements, with the most common cause being the heavy bench press. If your client has poor posture with medially rotated shoulders, then they have a greater predisposition to this type of injury. So what, as personal trainers, can we do to prevent weightlifter shoulder from occurring in the first place or to avoid it getting worse? Firstly, we need to consider the client's technique during a bench press. 1. Ensure correct scapular retraction during the eccentric phase of a bench press. This will limit the shearing force on the AC joint. When bench pressing, don't let your client go below 90 degrees of elbow flexion if they have any AC joint pain, as basically at this angle, the scapula are almost at full retraction, so going any lower will increase the shearing forces on that AC joint. Consider replacing an open chain bench press exercise perhaps with a push-up, and then progress the exercise by adding some weight onto your client's back. Replacing also the bench with a fit ball during a chest press exercise will allow for greater scapular retraction. We should also aim at improving our client's shoulder posture by releasing the muscles that internally rotate the shoulders and reactivating and strengthening the muscles that externally rotate and stabilise the shoulder.